given an opportunity to have something done about my spine problem. In Canada, they wouldn't address it or even acknowledge it. So I came here. I was given an opportunity to get it fixed right.
What was it like being on the waiting list in Canada?
I didn't even get on a waiting list. The surgeons refused to put me on a waiting list. If half of them would look at my MRIs and say there's nothing we can do, or the other half wouldn't even look at my MRIs and just walked out of the room. So
do you think you made the right decision?
Oh, absolutely, 110%. Oh yeah, you can't get this quality of care in Canada. It doesn't matter how much money you have. It's not there.
How do you feel now? Are you nervous about the surgery?
Not in the least. No, I thought I would be a little bit, but actually I'm completely calm, completely at ease. The professionalism of the doctors and the nurses, they're all been so thorough. You can't be nervous. They're so confident, it makes me confident. So.
How much is the surgery cost you?
It's being taken care of by an anonymous benefactor, shall we say. I didn't have the money to have it done, so some wonderful people have been taking care of this.
Okay, thank you, and all the best for your surgery.
Thank you very much.
To come to India for the surgery.
What do I think of that?
Mm-hmm.
It was a long trip. I think, if I'm not mistaken, it was about 10,000 miles by what I was reading in the airplane. But when you think about 10,000 miles, and the doctor here says it will take an hour and a half to allow my son to work, to do anything he wants, that he has been in pain for 4 years or better, that's a miracle. It was well worth every minute, every dollar. It's a life-changing experience for not only Jeff, but myself also.
Are you upset that this surgery couldn't be done quickly in Canada?
Frustrated would be the word to use. I explained to one of the doctors yesterday, this is the best kept secret in the world, the talent and the expertise that you people possess here. And I said to Chennai, they said, what for? I said, for surgery. And they looked surprised, and they said, why would you come to our country? I said, because you're the best. That's why we're here. And it's proven out. It's proven out.
Can you afford to come here for surgery?
I'm sorry?
Can you afford to come here for surgery?
You cannot afford not to come here. That's the simplest way to put it. I have many friends at my age, younger, that have died waiting to get on operating tables. I've had friends been told that if you had been here earlier, you won't die in 3 weeks. But they waited for 2 years with cancer and have no hope now other than to wait and get their papers in order. It is amazing the speed of which this organization handles things. From testing, we waited 1.5 years to get an MRI on Jeff. We came here and in less than, what would it be, 4 hours? He was out, gone, the results are back. Jeff and I were commenting that in 1 hour of being in this hospital, there were, I think, no less than 4, maybe as high as 8 people in here. We knew more in 1 hour than we had known in the last 5 years about his health, just by the quick diagnostics, his skill, and integrity of the people in this hospital. Second to none.
So do you feel you've made the right decision?
Oh, no question. Absolutely. We have run out of words to use. I'm emailing back to Canada constantly.
Hey, all the best, Jeff.
Thank you.
All the best, Jeff.
Hey, all the best, okay?
Thank you. I'll see you soon.
Yep.
Yeah.
I'm looking forward to it.
We call it hypermobile. That is, it had above the normal mobility.
Normal or
Beyond the normal.
beyond normal?
Abnormal mobility.
Abnormal. Okay.
At least on table. That was
I see. I see. Was it more difficult?
Is remove the damaged disc
Yes.
at two levels, the L4-5 and the L5S1. The joints at the back, what we call as the facet joints, were also severely damaged. And we have put in screws at 4, 5 and the sacrum. And we are fixed with rods on both sides. And we have put measured cages.
Hector, how many Canadians come here for surgery?
Well, we have had a few coming in the recent past. Some have already had surgery done for them a few years back, but they didn't get better. And some come here when they are not offered surgery despite their severe back problems.
What do you think of how Canadians have to wait for this kind of surgery if they want to, get it done in Canada?
It's not right for me to comment on another medical health system. I'm sure that's a great country. But when patients come to us, we look at them the same way as we do with our regular patients, our local patients. So we try to find what's the best treatment.
How complicated is this surgery?
Spinal surgery is considered dangerous and complicated. And there are different kinds of spinal surgeries, of course, but we do complicated surgery on a routine basis. So for me, it doesn't remain complicated anymore.
What about Jeff's surgery? Could you tell us how complicated, how long
See,
it is?
Jeff had 2 damaged discs, as I was telling his father. And also the joints at the back, what we call as the facet joints, were severely arthritic. And this was particularly at the L4-5 level, that is the segment just above. What we needed to do was remove those damaged discs, fix the 3 levels with special titanium spine implants. And once we had done that, we had to restore the disc height after curating out or removing the disc material by putting in spacers made of special biocompatible plastic.
That's what I was wondering.
Kind of a shock to the system, isn't it? They're very pleased, very encouraged by what they found. They repaired. Screws in, titanium, the whole thing. You're all bionic.
Completely. It's a full rebirth. I thought, like I said, thanks. The more I walk, the better it feels.
Wow, that's something to see it. It's